Hi everyone. In this PowerPoint presentation, we will be talking about the role of diet and nutrition in women with polycystic ovary syndrome, also known as PCOS. We will begin by talking about what PCOS is, along with its characteristics and symptoms. We will then move on to the risk factors and long-term health consequences. Lastly, and most importantly, we will discuss its treatment strategies and how we can heal the syndrome through diet and nutrition, because diet and nutrition play the biggest role in managing PCOS. Polycystic ovary syndrome is the most common endocrine system disorder in women of reproductive age, which appears as a set of symptoms and disorders with mild to severe protests in the functioning of reproductive, hormonal, and metabolic systems. This syndrome is characterized by irregular menstruation, polycystic ovaries, and hyperandrogenism, insulin resistance, and obesity that is observed in 5 to 20% of women, depending on the diagnostic criteria that is used. It is said that PCOS affects 1 in 10 women and affects over 7 million women. Symptoms of PCOS include the endocrine system and reproductive signs, which occur in the shape of amenorrhea, which is absence of menstruation, oligomenorrhea, which is infrequent menstruation, hirsutism, which means excessive hair growth, obesity, acne, male pattern hair loss, and reproductive disorders. The psychological aspects of PCOS have received inadequate attention, but women with PCOS diagnosis have higher levels of psychological morbidities, including anxiety, depression, and body dissatisfaction. The actual cause of PCOS is unknown and probably stems from a combination of factors such as genetic factors, where certain genes might be linked to PCOS, exposure to high levels of androgens prenatally. Androgens are elevated levels of male hormones, which result in physical signs such as hirsutism, severe acne, and male pattern baldness. Then epigenetic factors, which are influences that lead to persistent changes in the epigenome. And environmental factors. Various environmental factors play a fundamental role in the occurrence and treatment of PCOS, among which dietary pattern, physical activity, smoking, and stress could be pointed out. Because of societal pressures to be thin, body dissatisfaction can occur and form eating attitudes in a variety of vulnerable groups such as PCOS, making societal factors a risk factor as well. In this slide, I will explain some of the long-term health consequences of PCOS. Women with PCOS have increased insulin concentrations and are at risk of becoming diabetic and developing metabolic syndrome later during their lives. Women with the syndrome have a 50 to 70% risk of developing insulin resistance. Insulin resistance plays an important role in the case of PCOS as a long-term issue of type 2 diabetes, which is present in 40% of PCOS-attained women. In addition, PCOS mothers showed a prevalence of gestational diabetes and small for gestational age, which might be attributed to the PCOS condition of the mother besides other factors. Obesity has significant effects on the clinical manifestation of PCOS. Menstrual and ovulatory disturbances tend to be more marked in the obese. Fertility is decreased and the rate of spontaneous abortion is increased. An increased risk for endometrial, ovarian, and breast cancer in women with PCOS has been suggested. Several cardiovascular disease risk factors have been associated with PCOS, including insulin resistance, type 2 diabetes, and possible hypertension. PCOS can be treated by paying attention to lifestyle factors, including diet and exercise. In approaching dietary management, it is important to take into account the caloric requirements of the individual, because every individual is different. Calorie requirements are higher for women with higher body mass and increase in relation to activity. It is way more beneficial to focus on the eating pattern and the macronutrient content of the diet rather than promoting healthy eating and weight loss in a hurry. Dietary and exercise interventions can promote weight loss and improve glucose intolerance. It can also help manage specific aspects such as menstrual irregularities and ovulatory infertility and hirsutism. Women with PCOS should be aware that a random diet which is not properly designed for PCOS can make the symptoms worse. Pharmacological interventions is another way PCOS can be kept under control since they improve insulin sensitivity and can assist with weight loss. Although this kind of treatment should only be considered as supplementation to diet, nutrition, and other lifestyle approaches. It should only be used if diet, nutrition, and exercise have shown not to have controlled symptoms on its own. Fundamentally, PCOS is a disease of overnutrition. Hence, the primary approach to management should revolve around nutritional approaches. Hormonal imbalances are caused if one is not packing enough vitamins and minerals in their food. Improvements in diet and lifestyle are essential methods of dealing with PCOS. The right kind of diet will fight insulin resistance, glucose intolerance, diabetes, and obesity associated with PCOS. Meals and snacks that are low in sugar and saturated fats and high in fiber-rich fruits and vegetables, protein, and healthy fats are recommended. The management of PCOS must include lifestyle modifications, and dietary and nutritional recommendations must be targeted to each individual's needs. In this slide, we will be talking about the macronutrients and the recommendations on what macronutrients are beneficial for women with PCOS. The first one is to eat smart carbohydrates. Not all carbs are bad. Women with PCOS should eat a carbohydrate diet that is low in glycemic index. Low glycemic index diets lower insulin response, decrease hunger, and promote weight loss. Low GI diet emphasizes on fibrous vegetables, legumes, and whole grains rather than simple carbohydrates and starches that are made from refined flour. Low glycemic index foods supplies glucose to the cells at a steady rate and leads to a moderate insulin demand, which in turn improves insulin resistance in PCOS women. In addition, women with PCOS show less overeating because the low glycemic diet is rich in fibers. Then they should eat high-quality lean protein. Evidence suggests that higher intakes of protein improve the glucose and insulin responses to a glucose load. Higher protein intake also increases satiety and helps with decreasing abdominal fat. The general advice is that the diet should deliver 20% of its calories as protein. This may be increased at the expense of other dietary components for short-term diets designed to help the patient lose weight or improve glucose tolerance. Then, women with PCOS should focus their diet on healthy fats. Good fats are their friends. Increased consumption of unsaturated fatty acids has been reported to improve insulin sensitivity. The longer chain polyunsaturated fatty acids, which are found in fish oil, have beneficial effects on metabolic parameters in patients with PCOS, as well as the Mediterranean diet, which is rich in monounsaturated fatty acids, as they have shown to decrease features of obesity and insulin resistance. Good fats like fish oil or fish or avocados, walnuts, flax seeds, hemp seeds, and chia seeds that are high in omega-3 are very beneficial for women with PCOS. Bad fats are the fats that are your enemy. Hence, care should be taken to limit the intake of saturated fats and trans fats. Although the focus is often placed on macronutrients, it is important to note that micronutrients are equally important. There are benefits to supplementation with omega-3 fatty acids and antioxidants. Alpha-lipoic acid may have benefits for women with PCOS, and fish oil has been found to address some of the issues PCOS presents. Recent studies have found that fish oil has insulin sensitizing effects, which can help to address the insulin resistance seen in many patients. The fat-soluble vitamins, which is vitamin A, D, and E, and some minerals have an impact on PCOS as well. Vitamin A may play an important role in the treatment of acne in PCOS, since low serum vitamin A was seen in patients with severe cases. Vitamin E decreases the inflammatory diseases in women. The supplementation of vitamin D and calcium up to their daily recommended intake values normalize menstrual cycles of 53% of women with PCOS after 2 months in one study. Chromium is a trace mineral that was reported to have positive effects on PCOS by improving glucose tolerance. I want to conclude by saying that it is very clear that diet, exercise, and weight loss are the most valuable allies in the battle against insulin resistance, glucose intolerance, diabetes, and obesity that is associated with PCOS. It is very important for women with PCOS to eat a healthy diet consisting of a range of macro and micronutrients. Meals and snacks that are low in sugar and saturated fats and high in fiber-rich fruits and vegetables, protein, and healthy fats are a PCOS woman's best friends. Lifestyle management puts nutrition therapy at the forefront of healing PCOS. It can make a significant difference in the lives of women who suffer from this condition. Multidisciplinary programs focusing on dietary treatment, along with counseling, exercise, stress management, and psychological support, are deeply rooted and reliable standards all PCOS women should follow. I hope you enjoyed this presentation. Thank you so much. Bye.